Technology has really driven the field of ophthalmology. When you come in to get your eye examination, you're going to see lots of sophisticated equipment, lots of computer-driven equipment, and lots of that technology has also translated into improved surgical outcomes. Our surgical devices have improved, again, with the assistance of computer-driven technologies. We're able to use equipment that's much smaller and much less invasive, which increases patient comfort and speeds up their recovery. And then, of course, the advancements in implantation devices, the lenses that we use with cataract surgery. We have such a broader selection, and it really can enhance visual outcomes for patients. So really, the technology that's available in 2015 has translated directly into our daily practice, and it really positively impacts all the patients we take care of. The surgical techniques that we employ to remove cataracts have changed greatly. Sure. The surgical techniques we employ to remove cataracts today have changed greatly over the past several decades. Part of it is with the equipment that we use. It has just improved significantly. Part of it is also the surgical technique that has been honed over decades of eye surgeons. Each successive group of eye surgeons passes on all of their skills and knowledge to the next group. And so everything I do today, I really owe to the eye surgeons before me. But of course, we continue to move forward with our techniques. And what that does is lead to quicker recovery. 30, 40 years ago, when you had cataract surgery, you were hospitalized. The surgery took place in a hospital. You stayed overnight for 2 or 3 nights. I mean, today, an open heart surgery patient will leave the hospital after 3 days in the hospital. Cataract surgery today is not like that at all. Basically, it's shifted out of the hospitals to outpatient surgical centers. Of course, our outpatient surgery center is an eye-only center, so the only type of patients that are taken care of there are eye patients. And the surgical times have gone down from a 45-minute to an hour procedure to a 10 or 15-minute procedure. Patients walk in, have the procedure done, recover for a half hour, and walk out of the center. It's so much more convenient logistically, and the recovery is far simpler. Most patients don't have any pain in recovery. So all of these developments in surgical technique and in surgical equipment have changed cataract surgery perhaps more than almost any other procedure. When you had sort of, let's call it the old-fashioned way of having your cataract removed, the patient would be uncomfortable for weeks at a minimum, and they would have 10 sutures placed in their eye that would need to be removed at a later date. Today, we generally don't use a single suture because our incisions are so tiny. We're talking about 2-millimeter incisions that they can heal on their own without the need for suture. So it also, again, it adds to the patient comfort, adds to the quick recovery, adds to improved vision. So all these things make today the best time in the history of man to require an eye surgery.